Hello, welcome. It's great to be with all of you. Thank you so much for joining. Today, we are going to cover leveraging technology and analytics to optimize workforce costs. Next slide, please. To set the stage, we will be discussing an incredible success story, really a journey, with AMN Healthcare's strategic partnership with Temple Health. In this session, we will talk through how Temple Health truly harnessed cutting-edge technologies and advanced analytics to transform, their workforce strategies, leading to substantial cost reductions, operational enhancements, overall clinician satisfaction, and improved patient experience. Next slide. Before we get started, I'd like to take just a moment for the team on this call to introduce themselves. I'll start. Hello, Leora Westbrook. I'm the leader and president of Workforce Strategy and Optimization at AMN Healthcare. I have the privilege of working alongside these esteemed colleagues and oversee strategy, technology, and analytics solutions and consulting offerings. With that, I'll pass it to Mo.
Thank you, Leora. Good afternoon, everyone. My name is Mo Abbas. I lead the vendor management solutions at AMN Healthcare, part of Workforce Technology Solutions. And I have responsibility over all of AMN's VMS solutions. There are three of them: ShiftWise, Flex, Medifast, and B4Health. Thank you very much for listening today. And pass it over to Kim.
Hi, everybody. My name is Kim Hansen, and I am one of the Vice President of Nursing and Chief Nursing Officer for our Women and Families Hospital here at Temple Health.
Wonderful. Thank you, Kim. Thank you, Mo.
Thank you.
So as I mentioned previously, we're excited to be here with you today to really talk through how Temple Health took a technology forward approach, driving data-driven decisions to manage their workforce at an enterprise and strategic level, leaning into both predictive and proactive automation to, again, improve the clinician and patient experience. Some of the highlights which we will all share as we walk through this, is how we've managed dynamic staffing models, supporting employee retention, reducing overall cost of labor, and ensuring that the right staff at the right time to take care of our patients when they need it most. Next slide, please. Kim?
So I'll give a little background on Temple Health. We are currently a 6 operating hospital health system, with the 6th one being our Women's and Families Hospital that will be opening in the next year. We have a current 979 licensed beds across the health system. We do approximately 35,000 admissions a year. And we have a huge volume of emergency room visits as well as outpatient visits. We are located in North Philadelphia, and our mission has always been to provide access of the highest quality to our community. We are in an area where most of our population is underserved. And so we value our mission and we live it every day. Making sure that we are efficient with our workforce is very important to us. So we were very excited to enter into this partnership, as we will talk about shortly. Thanks.
All right, so I'll take it from there. What I wanted to do on this slide is really give just an outlook of the Temple workforce landscape. The AMN Healthcare partnership built a foundation of data, guidance, and utilization to reallocate and balance the workforce, really helping Temple with a comprehensive workforce strategy approach. AMN was able actually to assist in significantly decreasing agency costs and saving over $3 million since 2021. Despite an increase in patient demand, Temple has been able to maintain a steady fill rate at about a 92%, which is actually higher than the regional average in the high 80s. Also, healthy fill rates were achieved by deploying two key strategies. Number one, increasing the core FTEs and the float pool FTEs, which has lower cost than the staffing agency cost. Number two, strategically prioritizing agency by utilizing data and maximizing their flexibility in the float pool. Data-driven staffing tools allowed for an enterprise transparency, accountability, and empowerment for nurses to advocate for themselves in the decision-making. Increasing that really led to a couple of things: increasing staff retention rate. Information and reporting dashboard really allowed for Temple leadership to have the necessary information to support the ongoing decision-making. After achieving an agency bill rate of about 18% below national average, which is actually a great achievement, we started actually shifting a little bit of focus back to increase the agency utilization to limit the overall spend on the core staff over time. Next slide. On this slide, I'm going to be talking about the workforce planning cycle. So usually the workforce planning cycle has four key components: data, strategy, planning, and evaluation. Let's talk a little bit about data. Data is a really key element to enable the decision-making. Having an easy way to access data, collecting, analyzing, and understanding the data, and then finally applying the data to be used for workforce strategy and decision-making is very important. And that's really lead us to the strategy. And this is basically the workforce strategy that we're talking about. We're basically mainly talking about identifying the business needs. And what is it really that we're trying to achieve from the workforce strategy? Then we get into the prioritization of these business needs, realizing that sometimes you have too many things that you want to achieve, so prioritization here is key. And that really leads us to the third pillar of the workforce planning, which is the planning itself. So that phase is really about our ability to forecast the workforce need. So based on the anticipated business need, what kind of workforce mix that Temple is looking for, or what we're trying to achieve, or the timing of the needs. We basically, that goes back to the availability of good, effective data that's easy to understand and apply. Then based on the forecasting, we actually start putting together the workforce planning, the workforce action plans. The last part of this workforce planning process is the evaluation. And it's really more like a gut check. We go back and say, did we really achieve the desired goals and the results that we were hoping for? Were we successful in making a change management or change to the environment that we anticipated? Are the assumptions that we relied on at the beginning still valid? And this is really a lot of time that really lead us into a new cycle of workforce planning, and basically goes back to the planning phase as well. If we can go to the next slide, please. The last slide here I want to talk about is really the solutions. One of the key success factors with the Temple program is really having all of the right components to manage a true comprehensive talent solution program. And that's basically a combination of technology and processes around it. So running a vendor neutral program on a VMS tech platform was very effective. But then on the top of that, this is where you have the workforce optimization solution combination with a SmartSmart technology providing predictive scheduling. Then finally, the RPO solution, which is really an acronym for recruiting process outsourcing, really helped build the core staff FTEs that really complemented an overall strategy approach for Temple. And I think with that, do we have any more slides, or are we ready for? Oh, I think we have more slides. So I think back to you, Leora.
Thanks, Mo. That was a great overview. And I'd share, just to take a step back to go forward, that the foundation of the approach and partnership has been our healthcare enterprise labor management, home, and the ability to produce those accurate predictions of need while leveraging the analytics that provide the prescriptive guidance. So leveraging Temple's data along with the guidance to deliver the intelligence, we are able to uncover what opportunities Temple should prioritize in partnership with them and deploy those to their workforce. And so the workforce analytics give Temple that consolidated view of both core and contingency, with the ability to drill down and see trends over time. That helps to explore patterns, determine root causes, and glean those actionable insights. And in addition to those analytics, the integrated scheduling solution, SmartSquare, is the only healthcare scheduling software that combines the demand forecasting with the robust scheduling functionality. So again, pulling to that enterprise transparency, coupled with the business intelligence tools in one application. I'll share that the SmartSquare scheduling tool is a SaaS platform, so it is a faster implementation. There's no versions to manage, and Temple receives those enhancements on a continual basis at no additional cost. We update weekly, and the predictions pass through the staffing matrices for each unit and service area. This allows us to clearly identify the predicted demand versus supply. And the technology is able to forecast Temple's patient demand, allowing for the proactive alignment of their staffing resources to start up to 120 days before the shift. So results showed that predictions made 60 days out are within one staff that was needed 96% of the time. And that improves as we get closer to the shift. So at the 30-day out mark, the SmartSquare OpenShift technology starts to come into play. And this is a patented sliding incentive scale that offers the highest incentives 30 days before the shift. And those incentives automatically decrease as the staff picks up shifts. So as a result, on average, we see 75% or more of open shifts filled more than 2 weeks before the shift. And the incentive ranges that are set by the organization are filled sooner and also importantly, in line with the budget. And so leveraging this integrated predictive staffing solution, this is a key tool to automate your workforce plan, coupled with the analytics that enable real-time decision-making and strategy pivots as needed. Next slide, please. I love this slide because it's a great overview. While it doesn't tell the whole story, it really shows how Temple has leaned in to achieve the flexibility and outcomes that we share here today. And in doing so, and proactively managing, predicting their staffing, they're able to remain competitive in the market in a highly competitive space, but still see reduced overall bill rates, still be able to strategically manage their float pools and their other dynamic staffing models. I would just iterate that no two client partners are the same. And as Kim shared, and I'm sure she'd be happy to elaborate, sending me up here, Kim, that this has been a journey and the strategy changes as the needs of the organization and the community around it change. And so that ability to leverage the tools to enable that and really be able to track that progress over time has been key for Temple to see that $12 million savings since our partnership in 2021. So with that, I will pivot us over to some Q&A. I see we've got a number of questions here, and please do keep the questions coming. If we cannot get to all questions, we will certainly plan to follow up directly. And with that, I'll pass it to Mo.
Sounds good. Thank you. Let me just take a look quickly here. So a couple of questions here. Kim, that's actually a good question. What was the change management strategy and how was it implemented? Meaning, how do you manage the changes as these, new systems are implemented and processed?
So for us, this was a complete organizational change. We started our journey with the initial workforce analysis, right? So we had, we supplied data, we worked together to try and figure out where we were and where we wanted to be. After the analysis was done, we looked at the data. We had a lot to change, right? So we started small in the beginning, but all of these things, and like you said, we've been in partnership, or we've been working together since 2021. So it hasn't been a huge amount of time, but in that time, we've changed a lot. Our first order of business was to create a resource management center, the RMC, and provide staffing resources in that location so that they were able to manage the systems and deploy staff as needed. That was a huge change. So we had to get everybody on board with trusting what was going to happen. And, for some healthcare leaders, they're very, they like to manage their own areas their own way and keep their hands on it so that they know that they're doing what needs to be done for the unit. We were actually turning over control into the Smart Square system and into the RMC, and that was a huge change. I think what helped us is seeing the results and constant communication about where we were and what was happening. Having a lot of interactions with the team from AMN as well as internally helped us keep that transparency going so that we were able to adjust and pivot if needed. It was a complete overhaul of how we do things. And here we are 2.5 years later, and there's very little concerns with what we've done. And where, actually we have shown, and I mean, all the data supports it, is that our fill rates and our staffing, we're staffed appropriately. That was the biggest challenge. That how is this system going to predict what we need? I know I need X number of nurses for Saturday night. And that just leaning in and trusting the system was very difficult, but we kept doing it. And from there, there is never concern anymore, truthfully.
That's great. That's great. Kim, another one for you. How has Temple Health changed its strategies over the course of this partnership? Meaning, how are the AMN Healthcare solutions, mobilizing that change? If you can just give us a little bit insight on that.
Yeah, sure. So we also went into this partnership in the middle of COVID, right? So everybody was scrambling to get staff, and agency levels were like, the rates were at the highest, and the ability to get staff was just becoming increasingly difficult. Here we are in a large city. We were caring for the most amount of COVID patients at the time. We were all confused and didn't know how to handle it. But when we went into this partnership, we were like, help us get staff, however, by whatever means. And, the VMS team took that and said, here we are in the market. If you raise your rates here, if you need specialty here, do that. Let's see what that gets us. And at that point, we were looking at people, resources. We needed the people here to help us take care of the patients. So that was working for us at the time. But over time, and as our resources became more available and our staff, we were starting to get people permanent replacements. The VMS team also looked at that as well and said, okay, time to start dropping these rates. Now let's look at how we can get more permanent people in here. So we went from, and this is just an example of how we've switched how we were using your services. We went from the highest rates that we needed to get people into, dropping the rates and continuing to look at that. And at the same time, recruiting for permanent positions. And now we're kind of going backwards because we also utilized the open shift, we started creating incentive shifts, but realized at some point that our incentive shifts were higher than our agency rates. So now we're rebalancing. Another example that was suggested was when we had agency, they were placed in separate units. So again, that controlling, like we need to manage our own people. But what we found was there were some units that had more agency utilization than the ones that had a higher vacancy rate. So we needed to like move everybody. So the suggestion from our partners at AMN was that move all of your agency into the float pool, right? So they were deployable to who needed them. That was allowing us to become more efficient with the agency workers that we had. Instead of paying for more here and here, they saw an opportunity that we were able to put them all in one area and deploy them as needed. So we did that, and that has been how we've handled our agency for the past year and a half now, and that's worked out very, very well.
That's great. That's great, Kim. I have another really good question. Just came in the chat here. I think it's related to more like planning, but change management. It basically was asking, was there a cross section of stakeholders from throughout the health system on the planning team?
So that is one of the things that, that maybe we could have done a little bit better. I think because the services were brought to the organization from our nurse leader, our nurse executive, I think people saw it as sort of a nursing thing. But in hindsight, when we've had our quarterly business reviews and all of that great information comes out, and we're very excited about it, we do like to include all of our executive leadership. And from those quarterly business reviews, I think that our executive team realizes that we could have been a little bit better at planning in the beginning. So we could have had them a little bit more engaged and really making sure that they understood that this was not just a nursing staffing tool. Yes, the nursing team, especially at Temple, is the biggest group of employees. However, it's so much more than that. It's so useful for finance to understand, and HR. And, while we did have stakeholders from HR at the table, obviously from finance, but supply chain, right? So like, how do we use these for like other areas of the hospital? I think that is very important. And we could have done a little bit better having a more robust executive leadership from the beginning and in the planning stages.
This is great. This is great. And to your point, a lot of change, big initiatives, and there's always some great lessons learned, right? So that everybody can benefit from. So thank you. Another question here is, can you speak a little bit to the importance of the approach of vendor neutrality that you managed in your hiring for your contingent workforce?
Sure. I think it put us in control a little bit, right? So we weren't working towards one company and like that was the only game in town. We had a blank slate, and people were kind of, or at least I feel like we were able to cast a wide net to everybody that was out there and really get the right people in here. I think that it kept us out of that feeling obligated to use one service because we've used them forever. It really took that away from our needs. We let everybody know what we needed, and then you guys worked your magic and got us within the prices, the rates and the people and the needs, and everything just kind of lined up. It took that burden off of us as an organization working with individual companies, that we were just working through you and we didn't have to worry about that.
That's great. That's great. And then one last question, and maybe after I ask we'll see if there's any more questions coming in. You obviously have done a lot in a very short period of time. In a change that's it's very up and down, right? Like in a time that's very change is not easy. What's next for Temple Health?
Lots. So I think we're still working on right sizing our staff, right? That's always important. It's always ever changing, and just keeping ahead of what our needs are. Right now, we're opening a new hospital, so using the services and putting an implementation plan in for that will be really important in the coming months. Looking at ways of optimizing the data that we already have access to. So it's something that we didn't talk about was there are dashboards for leaders to go in and look at their own information. And just utilizing that on a day-to-day basis, like maybe for incidental overtime. So now we've right-sized our staff. Like let's try to optimize and be financially responsible with who we have and what we're doing. So looking at different things, turnover rates, like which units have a higher turnover rate, and how can we like fix that so that we're not adding additional costs for orientation, unnecessarily, if we can try and just focus on the areas that need it. So I think optimizing now is really where we are.
This is great and exciting, and we're excited to kind of drive this journey with you, Kim, moving forward. I'm just actually checking if there's any other questions that are in the chat, and I actually don't see any other questions. And again, we're happy to get these questions a little later and ask them, send in answers. But at this point, there are no other questions. Anything else to close with, Leora or Kim, before?
Just underscore again the nature of the partnership and the trust, transparency, and collaboration. Those elements were fundamental for Temple to make the transformative changes that they have made and continue to make. And so we just really appreciate the opportunity to partner and continue to do so. And I am just so excited for where Temple is headed next. I really do enjoy sitting across from you, Kim, and your cross-functional team members in our quarterly business reviews and other sessions. I mean, we have finance and operations and clinical and HR, and it's so great to review the data and assess progress and then discuss as a team where we see opportunity and stack hands on where we want to go next, because there was always something more that we can do together in that continuous improvement and innovation space. So thank you, Kim and Temple Health, for being the true partners that you are. We appreciate it so very much, and sharing your story.
We appreciate our partnership just as much. And thank you guys for inviting me to highlight how we've come along. I appreciate that. Thank you.
Absolutely. I do see, Mo, one question that came in, I believe, from Vince. What is the name of the VMS Temple selected? Can you talk a little bit about that, Mo?
Sure. Yes. It's so we have been running the vendor neutral on Medifis for Temple Health. And it's actually fitted really well their specific use case. And I think, based on the introduction that I actually just mentioned at the beginning, Medifis is one of the 3 platforms that we currently have: Medifis, ShiftWise, and B4Health. But that's what Temple has been running on Medifis. Good question.
Don't see anything further in the chat, but again, please don't hesitate. I believe the contact information will be provided. Reach out, ask questions. Would love to share more details. And thank you so much for the opportunity to share Temple's story and our partnership.
Thank you. So
thank you very much.
I wanted to come on behalf of ASHRA and thank our sponsor, AMN Healthcare, for bringing us this presentation. I also wanted to thank Mo, Kimberly, and Leora for sharing their expertise.
Thank you.
Thank you very much.
Thank you.
Bye-bye.